Very good.
Had to adjust the,
Okay.
we're live.
Hello, I'm Dr. Susan Chandler, Program Coordinator for Integrative Health at Massey Cancer Center. Joining me today is Dr. Keith Bell. Dr. Bell is a doctor of acupuncture and Chinese medicine, and he'll be discussing acupuncture and its role in the contemporary oncology setting. He'll also explain what is meant by the term energy medicine, and in the process, hopefully demystify it. If you have any questions, should time allow, we'll address them at the end of his presentation. So just type them in the comments section. And just so you know, the session is being recorded, so everyone has been muted. Dr. Keith Bell, thank you for joining our Healthy Living series.
Thank you, Dr. Chandler. I'm getting some, can you hear me? Got it. Thank you, Dr. Chandler. It's great to be back. This is what, the third or fourth time we've been together talking about acupuncture and its use for cancer therapies. It's great to be here. As Dr. Chandler said, I'm a doctor of acupuncture and Chinese medicine. I've been practicing in Richmond, Virginia for about 21 years, and I started my career off in oncology and then later mostly reproductive endocrinology. So today I want to present to you all kind of a demystifying of energy medicine and acupuncture and the role that it plays in a contemporary cancer care clinic. So I'm not very technologically adept, but here we go. There we are. So again, acupuncture in the contemporary cancer clinic, energy medicine demystified. So one of the first things that I like to talk about is if you're not familiar with energy medicine or with acupuncture, people hear energy medicine and they think that it is, hold on, I am trying to get this to move. Here we go. They think of things like this. They think shamanism. They think in Asian cultures, Qigong medicine, shamans in Mongolia, curanderas in Latin America, Reiki healing in the West. So basically what happens is they think that energy medicine is a type of medicine that is distinct from conventional Western medicine practices. But every country, every culture has energy medicine in its culture, including conventional Western medicine. And it was Albert Einstein that said everything is energy, that's all there is. Match the frequency of your reality to what you want and you cannot help but get that reality. So energy medicine, again, it is in a conventional allopathic setting. We use it every day. We use it every day in cancer care. We use it when we're doing x-rays. So when you get an x-ray done, that's conventional medicine using energy medicine. When you get an ultrasound done, that's conventional medicine's ability to utilize sound waves. Radiation therapy as a treatment is using energy to actually treat with the radiation. MRIs. MRIs are a way of using magnetic resonance. So you're using the energy bouncing back and forth of magnets to actually diagnose. So energy medicine is something that is in our culture. So it is a part of the culture and it doesn't have to be this mystical curandera or healer in Mongolia or even Chinese medicine practitioner. We're not doing something that is different, culturally different. We're utilizing energies, or the same energies that we utilize in a conventional medicine setting. We just utilize more subtle energies. So again, when you see your conventional practitioner, you're utilizing x-rays, ultrasounds, radiation therapy, even lasers. Lasers are just a very condensed form of energy that you're using for surgery. We're using cold lasers to heal inflammation. But when you're dealing with Eastern medicine, we're using things like acupuncture. We're using Qigong, which is a movement therapy. A lot of times we use meditation and other energetic forms of medicine here in the West are things like laser puncture, music therapy, using essential oils where you're harnessing the vibration of the plant to utilize their sense to change you energetically. People use medicine bowls and healing touch. And so my point here is that there's not a culture in existence that doesn't utilize somehow some form of energy for both the diagnosis and treatment of disease. And every day we're surrounded by an electromagnetic spectrum. So basically we're swimming in this soup of energy, and energy is always affecting us. So we're being influenced by radio waves, by low frequency cell phones, by microwaves. We're being influenced by the energy, the infrared radiation of the sun, and visible light and ultraviolet rays. And then we get up to diagnosis and treatment where we're using X-rays and gamma rays. So this is what I mean by demystifying what acupuncture in Chinese medicine is, because when I get to acupuncture and I talk about the energy or the qi that we work with, it is no difference from these energies that we are around and in the midst of, influenced by on a daily basis. So again, biological life is always in an energetic field. We're constantly surrounded by radiations, be it from the influences of the sun and atmosphere and geomagnetic to the electrons and ions and protons and neutrons in our body. As the atoms are swirling, they're creating an energetic wave, as so to speak, or radiation that we can tap into, and we do tap into from a Chinese medicine perspective and from a conventional medicine perspective. And so when you look at us on a when you look at us from an atomic point of view, we're basically more space than we are density. So on an energetic level, you know, we're density and we appear to be solid, but really within us, there's more space. And in that space are energetic influences from outside and from within. And so what happens is conventional medicine realized that there is something to these energetic medicines that are classical medical systems from other cultures. And they realized that people were utilizing these medical systems, and they started doing research, and they thought that, you know, let's try to integrate energetic medicine into a conventional medicine setting. And it really took off about 20 years ago from a fertility medicine point of view. So what's happened is these classical energy medicines like traditional Chinese medicine, Ayurvedic medicine from India, even Native American medicines from the Americas, they had something that took into account the body's own natural energy responses in healing. And conventional medicine said, we need to start looking into this. And so it started taking off. At one time, it was called alternative and complementary medicine. But in about 20 years ago, medical systems started to integrate these traditional energetic medicines into conventional medical systems. And we see it a lot in fertility medicine, sports medicine, addiction medicine, and pain clinics, palliative care, and integrative cancer care, which is what we're going to be talking about today. So let's get the terms straight so we know what we're talking about. Now, when I came along 25, 30 years ago and started practicing, it was complementary and alternative medicine. And alternative medicine, you know, was when people chose to seek out a form of medicine in place of conventional medicine. So we formed the complementary and alternative medicine, in the NIH formed a complementary and alternative medicine research institute, and they wanted to look into why people were using complementary and alternative medicine and how often people were using it. Alternative medicine is not really a term that we use much these days, but it is still a practice of choosing a medical system outside of conventional medicine for treatment instead of using conventional medical system. But then came complementary medicine, and complementary medicine really took off around year 2000. And it's when conventional medicine started utilizing what was considered alternative medicine systems like acupuncture, Chinese medicine, Ayurvedic medicine, naturopathic medicine. And they used it to complete or to enhance conventional treatments. And so what they were doing was having patients seek out acupuncturists or chiropractors or naturopathic medicine practitioners to complement the conventional medicine care. And then we started moving into recently an integrative medicine system. And an integrative medicine system is when you actually combine treatments from conventional medicine and alternative medicine, and you actually form a treatment plan together. So instead of seeing one physician for traditional medicine and another practitioner for medicine to complement, then the physician started talking. So that's when I started talking. My integrative medicine practice happens to be in fertility and reproductive medicine. So I meet with other fertility doctors about patients, and we discuss the patient care, and we come up with an integrative approach. So we take the best from my medicine system, which is the Chinese medicine system, and the best from the conventional medicine system has to offer. And we develop a personalized treatment plan that utilizes the best of each system. And that's an integrative medicine approach. And that's where we're moving. But why the interest? Again, how did this happen? It wasn't really planned, but what happened was we realized, the NIH realized that people were spending $34 billion a year. And this is in 2007, so it's a lot more now. But they started asking themselves, why are patients spending $34 billion out of pocket a year? Why are they going to acupuncture, naturopathic medicine, Ayurvedic medicine, and they're willing to pay cash, and they're not willing to pay the conventional medicine practitioner out of pocket? So it became an area of interest. What is the reason, what is the motivation that people are willing to pay me money, cash money, and they're not willing to pay their conventional doctor? They want their conventional medicine to be covered by insurance. And so it was about money, and that started the interest. But then conventional medicine really took hold of integrating complementary medicine approaches. And that became, even here in Richmond in 2014, the top docs based their entire yearly magazine on integrative medicine. So they wanted to interview physicians, and this is Dr. Isaacs on the cover, who's from VCU, OBGYN, but they focused on practices that communicated and did integrative medicine. And so they did an article on Dr. Shaw and I, and this is us practicing reproductive medicine, where we're discussing a patient and how to utilize Chinese medicine and conventional medicine to form an integrative treatment plan. So integrative medicine is here, alive and well now in Richmond, Virginia. And it's alive and well in integrative cancer centers. So cancer treatment centers are one of the big resources now for integrative medicine. And if you look on the websites, the National Cancer websites, NCI designated websites, they'll talk about what people are utilizing, what's being utilized. So they talk a lot about exercise. They talk a lot about acupuncture and meditation and yoga and massage and music therapy. But then they talk about what is actually offered in the centers. And if you look, nutritional consults are offered in 91% of these integrative cancer care centers. Meditation and yoga, massage and acupuncture and herbs, and then therapies like dance therapy, healing touch, hypnosis, qigong, and Reiki, and herbs are 66% utilized. But acupuncture is being utilized in 73.3% of these integrative cancer care clinics. And so that's why we want you to understand what acupuncture and Chinese medicine has to offer and how you can utilize it. But first, what is acupuncture? Because a lot of people don't understand what it is. So it's very simple. Acupuncture is simply the insertion of a pin, a small needle. It's a 40, I use a 40 gauge needle. So it's more like a solid, very small pin, hair thin, into a specific point in the body. So we're taking a pin and we're putting it into a very specific point in the body where it penetrates the skin. And when we manipulate it, it changes the electrical magnetic impulses in the body. So that's that energy medicine we're talking about. So we're actually inserting a little small pin in the body to change electrical impulses. And that happens in the fascia, we now know. So I'll talk to you about what we call it in Chinese medicine, where we talk about qi, or the energy, and we talk about it flowing in meridians, which are pathways. But what we now know is that we have a layer of tissue that's called fascia. And when I was in med school, we just learned fascia as tissue, as connective tissue that is everywhere in the body. But we now know, as of about 5 years ago, that that tissue is actually active. It's not just a passive tissue. It is full of electrical impulses that have an influence on every other aspect of the body. It affects the immune system, the endocrine system. It affects changes in brainwave activity. So we now know that when we insert this pin into the body, into the fascia, it changes the electrical impulse, and that electrical impulse carries information. So acupuncture is simple. It is taking a small pin and putting it into an acupoint, which is a very specific point on the body, to affect change. And it is painless. Now, acupuncture, what a lot of people don't realize, comes from a whole system of medicine. So a whole system of medicine is like our conventional Western medicine. It's like Ayurvedic medicine, homeopathic medicine. So it's a system of medicine that you can diagnose and treat and never have to step outside of that system. So remember, when you have an integrative medicine practice, you're taking two whole systems of medicine and bringing them together to utilize the best that each system has to offer. So I like to tell people, don't confuse acupuncture with the system of medicine. Acupuncture is one of the tools that we use that we can both diagnose and treat disharmonies, disease, or foster healthcare. So in Chinese medicine, acupuncture is used in a system of medicine that we call traditional Chinese medicine or East Asian medicine. But there are other things that we utilize. So we also have acupuncture is what most people seek out in the West, because we have this mindset that when we're sick or something's wrong with us, we go to the physician does something to us to make us better. So a lot of people come to me because they want acupuncture. They want something active that I can do to them to help them heal, to help them get better. But we have other tools in our box, because we want the patient to actually have control over their treatment and to have influence over the treatment. So traditionally speaking, acupuncture was usually the last tool that we utilized, because it involved a dependence or reliance of the patient on the practitioner. So the patient has to come to the practitioner in order to be treated. But what we would do beforehand is we would look at lifestyle. So when you come to an acupuncturist or doctor of Chinese medicine, they're going to ask you 1,000 questions about your health and lifestyle, how you use your body, what you put in your body, what comes out of your body, when you go to sleep, when you eat. We want to know everything that you do physically, mentally, emotionally, and spiritually. And so we look at your lifestyle, and does your lifestyle support your health, your wellness? So we look at lifestyle, we look at the food that you eat. So we have a Chinese medicine way that we actually have food therapy. So we'll look at food as medicine and as nutrition. So are you on a healthy nutritional diet, or do you need a medical diet that you have to balance out some disharmony? And a medical diet is very different from a daily nutritional diet. So sometimes when a person is far out of balance, we have to put them on a strict diet to bring them back into balance. So we use food, we use diet, we use Qigong, which is a breathwork meditative movement. So it's like India's yoga practices. So it's specific movements designed for health and healing that's coordinated with the breath. We also use herbal medicine, and herbal medicines involve plants, minerals, and animal substances. So it also involves foods. So we have that in our medicine cabinet. We also have Tui Na, which is kind of like massage therapy from a Chinese medicine perspective. So we're actually manipulating the tissues and the bones and the connective tissues. And we look at the environment. So we call that feng shui. How does your environment impact your health? Are you working in an unhealthy environment? Are you living in an unhealthy environment? Is there mold in your environment that's contributing to your health? So when you see a practitioner of Chinese medicine, what I want you to know is we're coming from a whole system. We have all of these ways in which we address disharmonies, imbalances, and illnesses. So it's not just acupuncture, but we are here to tell you how we utilize acupuncture. So remember that acupuncture is just one modality. We can use it both as a diagnostic tool and a treatment, but it comes from a whole system of medicine in which we can diagnose and treat within that system of medicine without ever having to step out. But in an integrative medicine system, we'll use that whole system of medicine with conventional medicine system and choose the best approach from all the tools that we have to put together a personalized treatment plan. So traditional Chinese medicine has been around for at least 5,000 years. We have a written history of over 1,000 years from when actually they started writing down acupuncture protocols. And the original acupuncture protocols were for reproduction, because cultures, in order to survive, have to be able to reproduce. So Chinese medicine has some of the oldest obstetrics and gynecological written medical documentation of any other medical system, and it still applies today. So Chinese medicine came here to the West. It came here to the West mostly from our point of view in the 1970s, when Richard Nixon went to China for the first time, and he took his press with him, and they witnessed an operation or surgery that only acupuncture was used as the anesthesia. And so there was an article, and I can't remember if it came out of the New York Times, the Washington Post, one of those, on seeing the surgery being done with acupuncture being used as the anesthesia. And so that made the West, the United States, very interested in acupuncture. And that brought more acupuncture practices opening up in the West. But as early as Marco Polo, he had documented acupuncture treatments. The Jesuit missionaries took some of the medical texts from China. When they left China, they would go to China as missionaries and leave and bring back the medical text to countries such as Spain and France and Germany. And then they would actually research on their own Chinese medicine acupuncture. And they developed some really interesting acupuncture protocols of their own right. But it was the 70s and the 80s that acupuncture really took off here in the United States. So this brings me back around to this energetic medicine that we're going to talk about. I'm going to check the time. So energy. In these traditional medical systems, in each one, they talk about that there is energy. So when I talked about that pulsation of energy in the fascia, Chinese medicine and acupuncturists call that qi. So it's been called a life force. It's been called energy, but basically it's saying that we are energetic beings infused with what Chinese medicine practitioners call qi. And this energy flows in pathways and it can be measured. So it flows from one system to another and you can actually measure it. And these pathways in Chinese medicine are called channels or meridians. So we have energy or qi that flows in specific pathways or meridians. And that's what we tap into when we're doing acupuncture. So there's specific points on the body that these meridians come to the surface, these energy channels come to the surface on the skin, and we can manipulate that energy using pins or acupuncture needles. And when you study acupuncture, you see it in, we study it in these two-dimensional textbook forms where it looks like just little dots on the skin and lines on the skin. But this picture to the left of meridian is more dynamic. So what we're seeing is that there's energy moving in the body. The body is constantly pulsating with energy, and that these acupoints and meridians are alive. They're dynamic. They're carrying a life force. And so in doing so, an energetic kind of field is around the human body, and you can change the physiology by tapping into that energetic field. You can diagnose by tapping into that energetic field, very much like an MRI does when they're affecting your energetic field using magnetic resonance. And these energetic pathways have been measured. So they have actually been scientifically measured. So now we're bringing in kind of now the conventional science behind how acupuncture works. So each one of these pathways or meridians or channels in which qi or energy flows has its own frequency. So scientists have taken these little machines and they will look at the hertz on each one of the pathways and each one of the acupuncture points, and they will see that it's different from pathway to pathway, so that we know that there are actually energy pathways in the body, whether we want to call them fascia or Chinese meridians or channels. We know they exist now. And you can find them by measuring how much energy is flowing through that pathway. And now that's how acupoints are actually found, because there's less energetic resistance at a true acupoint. And again, an acupoint is the point on the body, on the skin, that we use to access the energy in the meridians at a specific point to influence change. So again, it can be measured, and it's been measured frequently. But what also has been measured is that each one of our organs has a different frequency. So again, we're going back to energy. We're making it less out there and showing the reality of it. So the brain functions at a specific frequency, and a different frequency depending on how your intellect functions, depending on the time of the day. We know that the human heart has its own frequency. The thyroid gland, the lungs, the liver, the pancreas, the stomach, the spleen, they all have their own frequency that maximizes their benefit and usage and wellness and health and harmony. So when the organs are vibrating at a specific rate, it can tell you whether they're healthy or unhealthy. And the same with the acupuncture meridians. They should be vibrating at a specific rate. And that's how acupuncture works, is you can actually change the vibration from point to point, from meridian to meridian, and you can change the vibration of the organs, because each of the pathways, the meridians, those energetic pathways that we talk about, they originate in our organs. And so the organ has to be vibrating at its specific rate so that that energy from the organ vibrates at its specific rate. And when it's not, you can actually change the vibration using energetic medicines such as acupuncture. And this is one of the studies of just measuring energy from heat. And so this is a study where they measured inflammation of a knee. And so inflammation is heat. It's increased energy of a specific area and it's putting off more heat. So the knee to the left is inflamed. So that's a baseline. And so they're using photography that measures heat or energy to show the effects of acupuncture after 20 minutes of treatment. So this person went in with an inflamed knee. The acupuncturist put in the pins, the needles, and each picture was taken 5 minutes apart. And so each 5 minutes, you can see a reduction of red. The red is the heat. The blue is the coolness. And so these pins stayed in for 20 minutes. And then the last picture shows after 20 minutes of acupuncture, and the inflammation was stabilized. And so that's one way that we actually measure effects of acupuncture, and you can actually see the energetic effect. You can see the inflammation dissipating after 20 minutes. So how do we use it in integrative cancer care? Let me check the time again, so we have 2 more minutes. So here's how people are using acupuncture. So not only does it decrease inflammation, which you can see when you're measuring it, but the main ways that we're using acupuncture from an integrative cancer care perspective is we're not treating the cancer. We're not using acupuncture to get rid of cancers in the body. We're using acupuncture as a way to enhance the treatment so that conventional medicine can do its job with less side effects. So we use acupuncture to reduce nausea from chemo, and it's quite effective. We use it to reduce joint pain, kind of what you just saw in the pictures of the knee. You can reduce the inflammation with just 20 minutes of acupuncture. We're seeing really great studies on preventing and reducing neuropathy from chemo medications and from radiation therapy. We're seeing that the acupuncture improves people's energy, so they actually just have more energy and a better outlook to continue with the side effects, continue with the treatment from a conventional medicine perspective. So we're seeing it improve energy. We're seeing it increase people's appetite, especially after chemo when they're nauseous and appetite is gone. We're seeing it with intestinal and stomach motility. So you can actually, when you go into your acupuncture treatment and you put in a needle for intestinal or stomach motility, you can hear it work. Within 5 minutes of putting on the needles, the intestines start moving. You hear the movement in the gastrointestinal tract. It's amazing. We're seeing it improve chemo fog. So that fogginess that people talk about after getting chemotherapy. So we're seeing that fog and the cognition. We're seeing taste and smell improve after chemotherapies and even COVID now. And we're seeing it build blood in the body. So when you're going in to be checked to see how the blood looks, we have some great research studies that show that acupuncture is improving the quality and the number of blood. So these are the main ways that we're seeing acupuncture utilized in the integrative cancer clinic. And this is one of the studies that I just saw this morning, but although it was done in 2008, and it's talking about, the research studies are showing that chemo-related neuropathies, neutropenia, fatigue, xerostomia. So we're seeing a lot of improvement in taste and in saliva production for people who are having throat cancers and radiation. So there are studies out there that show the effectiveness of acupuncture in Chinese medicine. And the World Health Organization released this review and report on controlled clinical trials because people like a controlled clinical trial, which a lot of them, acupuncture itself doesn't stand up to very good in a controlled environment because acupuncture is not done in a controlled environment. Acupuncture and Chinese medicine is very individualistic. So this is why a lot of the controlled clinical studies you'll see on acupuncture don't necessarily hold up because the acupuncture is done in a way that it would never be done clinically. but we're seeing really good effectiveness studies. So when you utilize Chinese medicine and acupuncture clinically, you're seeing very good results. But here are a review of some things that the World Health Organization does see really good responses in a controlled clinical environment. And so some of these things you'll see that people get from cancer treatments, especially like the nausea and vomiting and post-operative pain, arthritises, pains, again, hypertension, hypotension. But this is just a list that I wanted to show you that if you go to the World Health Organization site, you'll see are used every day for Chinese medicine and acupuncture treatments. And I want to talk just a little bit about the power of the mind to heal, because again, since acupuncture doesn't stand up so well in controlled studies, but it does clinically, people started looking at acupuncture, well, is it a placebo? That's been ruled out. We know that it's not a placebo, but we do know that the power of the mind to heal needs to be integrated into treatments. And so basically, what we're looking at is if you start changing, when you start utilizing other medical systems, such as acupuncture, homeopathy, Ayurvedic medicine, it gives you a different framework into looking at disease. And so the more that we're exposed to, the more frameworks we have, then we can look at diseases from a different way. And so when you learn how to look at the body from an energetic level, it just gives you another perspective in ways that you can make change for health. And it also helps a person find meaning. And so when I talked at an acupuncture, not an acupuncture, but a cancer care symposium about 20 years ago, I remember the title of it was Cancer as a Turning Point. And it was a symposium about people who had used cancer to turn their lives around. And the way that they did that was they found a way to make meaning out of their disease. And one of our needs, if you look at from a psychological perspective, one of our human basic needs is to make meaning out of our experiences. And so one of the things that we do as Chinese medicine from a Chinese medicine perspective is we sit with patients and we help them find a way to make meaning out of the things that have happened to them, out of the traumas, out of the disease. And in doing so, it actually opens up the body to heal, because we have to have, again, a fundamental need in humans is to make meaning out of our experiences. And so by utilizing what these at one point were called alternative medical treatments, which are now called integrative, basically it gives you an alternative way of thinking. And it's just like when we learn new languages. People who speak more languages generally have more choice. They have more understanding of situations, because every language is a reflection of a viewpoint of that culture. So when you start utilizing other medical systems and integrating them into your conventional medicine systems, you're utilizing a new way of thinking, and it gives you, again, more perspective and more choice. So I included here some places that people can go for acupuncture research, because even though I was talking about some of the research doesn't hold up, there's some great research into acupuncture and Chinese medicine. And there's a lot better research coming out now, because we're realizing better ways to actually research acupuncture, because acupuncture can't really be researched in a double-blind controlled study. So now they're figuring out ways to actually research the acupuncture so they can figure out more how it works, like simply doing functional MRIs while you needle an acupuncture point, and they can see areas of the brain changing. And so we know that it works, but now we have to figure out how to measure how it works. So the research is getting better and better and better. And then you want to find a qualified practitioner. And so one of the ways to do that is to go to the National Certification Commission of Acupuncture and Oriental Medicine. We as acupuncturists, as Chinese medicine practitioners, are licensed by a professional board, and in each state that licensing can be different. So the state of Virginia licensed acupuncturists and Chinese medicine practitioners differently from California, differently from New Mexico, Florida, New York. And so you have to look at how each state licenses the practitioner and make sure your practitioner is licensed. But you can also go to the National Certification Commission, which is our national testing board, and you can see if a practitioner has completed at least the standards of practicing acupuncture and Chinese medicine. And they'll have that listed on their website, which is nccaom.org. You type in, find a practitioner, type in your zip code, and it will show you within however many miles you want practitioners in your community that are certified by the National Certification Commission. So you do want to find a qualified practitioner, because there are some states still that don't license practitioners. So you can have practitioners practicing acupuncture with not meeting the standards of practice. So you want to check into that. So that is my little spiel on how acupuncture and Chinese medicine is used in cancer care, what acupuncture is. And so now we're going to see if there are any questions or have a little dialogue.
Dr. Bell,
There you are.
that was a fascinating presentation. And that has really opened up a lot of questions, I know, for me, as well as the people that have been listening to you. Before we begin, I'd just like to know, do you mind giving us an idea of the range of fees for acupuncture treatment? Because if I'm correct, it usually involves more than one session. Is that right?
It does usually involve more than one session. Now, the way that we kind of measure how many sessions that a person will need is how long a disease has occurred. So if a person has, if this is something new, say chemo-induced nausea, that can respond in one session because it's new. It's acute. It's a response to a recent event. And so that can change in one session, but that's different from migraine headaches for 15 years. So we kind of look at a month of treatment for every year a condition has existed. And that's very general because it is also individualistic. If something is acute, it will respond in 1 to 2 treatments. If something is chronic, it'll respond in 3 to 5 treatments. And treatment costs range anywhere from, I would say, $60 to $125. I think the average is about $95 a treatment.
Thank you. Well, is that something that's ever covered by a third-party payer, say private insurance or Medicare?
Okay, it is covered by some insurance companies. Now, again, insurance coverage is state to state also. So the laws that govern acupuncture and how acupuncturists can practice also will govern how insurance companies will cover. So there are more and more insurance companies covering for acupuncture, but for specific conditions. So a lot of insurance companies will cover side effects from chemotherapy and radiation and pain. And so I think Medicare now is covering treatment for pain, but you need to look into the restrictions, because even though they cover, it can be restricted to certain practitioners and it can be restricted to certain diagnoses. So always call your insurance companies because it's changing year to year.
Great. Good point. One of the things that you addressed early on was terminology, and I really respect that you clarified the difference between alternative medicine, complementary medicine, and then traditional. I think that's an area of great fogginess for many people.
And you bring up a great point, because people say if you're going to seek out a Chinese medicine practitioner or an acupuncturist, you really need to ask them how they practice, because some acupuncturists do practice alternatively. Like, they don't want anything to do with conventional medicine. They practice on their own, and there's no relationship between the acupuncturist and the conventional medicine practitioner. And that's what gets us sometimes in hot water, because you may go to an acupuncturist, and the acupuncturist or naturopath or Ayurvedic practitioner, it's not limited to acupuncture, may say, I want you to come off all of your medications and only do what I do. You need to know that about your practitioner. So you need to ask that before seeing them. Do you practice complementary medicine? Do you practice integrative medicine? Will you have a conversation with my primary caregiver so that we can understand what the treatment is? And that's very important.
Great point. Thanks for clarifying that. I never realized how much space our body had in it when you talked about
We
the
have a lot of
energy.
empty space.
That was fascinating. And also, I want to thank you for including the slide with all of the different uses of acupuncture in the cancer setting, because certainly from individual to individual, as a result of their cancer treatment, as a late effect, even as more and more people are surviving, living
Right.
longer, this really opens the door for additional treatments.
Yeah, a better quality of life. Yeah, because as we live longer, we do suffer a qualitative aspect. And, that's what I love. So when you practice in an integrative setting, you're using quality of care. So you take into account the person's quality. So the longer we live, the more we have to focus on our quality of life and not length of life. And so
Absolutely, great point. Dr. Bell, that was just a wonderful presentation. I hope you'll come back and talk with us again.
I will.
Oh, I'd love that. And I'm sure our viewers would. And before we leave, I always ask our speakers if you had any messages or parting shots you'd like to leave with the viewers.
My big message is always to not take things personally. This is a big speech of mine when I'm talking about wellness, is we can't take everything personally. When things happen to us that affect us and traumatize us, we have the power to stand back and say, this happened, I can change it. I can make meaning out of it. I'm not necessarily a victim of it. And when we take things personally, why me? Everything always happens to me, nothing will ever get better. It stops us from growing, and it stops us from healing. So always, when negative things happen, when bad things happen, just step back, acknowledge it, take control over your reaction to it, realize that you always have the power of how you're going to react to a situation. And that little bit of control, knowing that you can react, you can choose your reaction, is incredibly healing, because one of the things we need to be healthy is a sense of control. And so don't take things personally.
Well, thank you so much. Great pearl to leave us with. And we look forward to having you back. Thank you, Dr. Bell.
Thank you, Dr. Chandler. Thank you, VCU.